It is an unfortunate reality for unhoused Canadians when they go to seek medical care for physical injuries, illnesses, or ailments that they are often discharged from the hospital directly to the shelter or possibly the street, where they struggle to meet their healthcare-related needs due to the unpredictable nature of being unhoused. This medical neglect of our unhoused population has led to many different questions. How can unhoused people who are injured, ill, or have mobility difficulties meet their basic needs? How will this population find proper housing? How will this population access proper healthcare treatment? Introducing ART Housing, otherwise known as Accessible Rehabilitation Transitional Housing. ART Housing is a specialized transitional home for individuals with physical injuries, limitations, and illnesses. ART Housing is a place where people can live and receive treatment for their injuries, illnesses, and ailments while simultaneously participating in a housing program. Through ART Housing, participants will receive skills and resources to gain long-term housing, education and treatment to optimize their physical function, as well as support with their psychosocial treatment needs. ART Housing participants will have access to a wide variety of treatment providers to ensure that all of their needs are met. These treatment providers can include registered nurses, social workers, occupational therapists, rehabilitation therapists, speech-language pathologists, housing workers, case managers, and of course, physiotherapists. Given this vast variety of treatment providers, participants will also have access to a variety of services through ART Homes. This can include group therapy, individualized therapy, skills group, gyms and rehabilitation equipment, adaptive devices, transportation services, and of course, multidisciplinary assessment and treatment plans to ensure that a participant's full needs are met and treated. Now, you may be thinking, who's going to fund ART Housing? There are two possible avenues of exploration in terms of funding. ART Housing requires the initial funding to purchase a building that this program will take place in, as well as funding to make sure it's accessible for all program participants. The first avenue is a social investment fund through an organization such as Intact Insurance. A social investment fund is a viable option as ART Housing aims to directly impact and benefit the lives of unhoused individuals. Additionally, a social impact bond would be another viable option to fund ART Housing, as this program would take stress off the shelter system through moving individuals from this system and placing them in traditional home with the goal of them finding long-term housing as well. ART Housing would take relief off of the hospital and healthcare system, as hospitals have the potential to discharge directly to ART Housing, as well as reducing the amount of unhoused people who return to the hospital or healthcare setting due to the barriers they face in accessing proper healthcare and rehabilitation care. In order to continue to fund this program past the point of purchasing the initial building, participants will be required to pay some portion of their housing benefit, or in some cases, insurance benefit, towards this program each month. As well, if clients are able to work during this period, they would get their housing at a very, very reduced rate, significantly below market rate rent. Services will be billed accordingly to insurance companies as well as OHIP. As well, ART Housing would also aim to be a place of learning and provide plenty of opportunities for students to come and learn with direct client care. This can include physiotherapists, occupational therapists, social workers, physiotherapists, assistants, and so on. As well, under the umbrella of ART Housing, there is the potential to own a business that sells and rent mobility devices to the community, as well as participants within the program. This would allow the profits to directly return to ART Housing to allow us to continue to fund the program and support participants as they work towards gaining permanent housing and optimize their physical functioning. Ultimately, the overarching goal of ART Housing is to provide a safe and secure transitional living environment for unhoused individuals who require physical supports and interventions for the provision of comprehensive biosocial-based healthcare treatment. Thank you for listening.
Created using Powtoon.